Fine. So uh, I think at this point to attend class at 11:30, but it's a common convenient time, and the problem we all face, I won't say it's a problem, but it's a more of we are sometimes confused to the strategy that how we complete that Harrison. And there is a subconscious pressure that you are doing MD medicine, so you should be knowing total Harrison. And many of the time, that's a strategy to tell people that okay, this guy knows Harrison or this girl knows Harrison very well, and we get impressed by that. Okay, so I will say, yeah, this is something impressive task to do, but meaning is more important and planning is more important. So today I will have just 20 slides and we'll be going through. I think I'll be having here most of you as a resident. Few might have just started residency for last 1 year, and few might have completed, or few are still looking forward to medicine residency, right? So we are at all phase, and I think this relates to most of our journey, that how these things work. Okay, so as such, I have kept this. It's like a proper medicine journey that what we are going to discuss today, or I think we are going to interact more towards that. So I'll give a brief idea, and after that, whatever doubts we will try to solve and sort it out. So most of the things today's will evolve around that. First is how to plan your learning, because that's a difficult task from a very first year. Then to know what is important, what is not important. Time to decide your super specialty, because that's a commonest doubt I get, and I interact with so many students, that what specialty I should go for and how are the scopes and all. So we'll go into that little, because that sometimes it's okay, or it's better to clear some air when we are getting trained or when we are reading. So it becomes very easy for all of us that what to focus more. Work life balance, as I keep telling, that this concept I do not believe much in, but it has to be emphasized. If work life balance is a concept in my life, I won't be taking class at this point. I will be sleeping, right? So that is the point. I love what I'm doing. So I don't go much into work life balance. It's like you should enjoy more work. Come to that part. This is very important. Goal of each year of residency. These are not fixed goals, but with majority people I've interacted who have completed the residency and right now who are in practice and all, we all feel that this would have been told to us from very starting. So it would have been easy. Preparing for final exam, and then a very important lesson that learning never ends. This is fine. This is an optional thing. I'm being very honest here. Okay. This is an optional thing. The total journey, we try to make it smoother with MedCAS. That's all. Otherwise, you can do it. Okay. So don't worry about that part too much, and let's move ahead. Okay. So the first is how to plan your learning. So here, the most important point is interaction. Okay, the interaction is the maximum way you can learn. Even if I say that am I updated with the cardiology point, what has come recently, one way is to read cardiology journal, to read Medscape or up to date what is new. That's the one way that you go into the media to do that. Sorry, just 1 minute. Yeah, so go into the available material to scroll things well, that you use the material, right? So material you have specific is, one is your Medscape, one is your up to date. Medscape is almost free. Up to date there is some charge. And a very important thing for this is something called QX Read. That's an app available. In that you get all the updates. Okay, QX Read, that's available on I think iOS and both the version. And I feel it is worth to explore that app, because my updates are majority of time coming from there, that I read it, and there you can select your journals and all that. We will come to an interaction when your doubts are there, what journals to choose and what to read, that will come. So that's the one way. But a better way to actually stay updated is to interact. I interact with almost all specialists during my hospital visits, or who are my friends, that I will keep asking what is new in your field or something. Mostly relevant to my practice, but that Initially it should be like you discuss with everyone and you find, okay, these are the new things which are coming. Now the problem here is, if you do not know the old things or the basic things, the new things do not make much sense. If you are not updated about the standard guidelines of hypertension, then talking about a new molecule coming into hypertension does not make much sense. So that again tells that we have to be good with our base. So keep building the base every day. That's very important. By reading books, that's a way. Okay. Second is acceptance. Okay, that it becomes so much difficult when we join the residency, and I think we all have experienced that when we joined residency, we were mostly doing very well with our entrance, so we got the rank and we got MD medicine and we are very happy. But in 1 month we realized that all 19 subjects are so volatile that we forgot even basics. It becomes difficult. Many of the people realize that, specifically when internship was not done sincerely. I was one of that kind, that I was clueless for first 2 months that what is happening. The language was new, the subject was totally new. So that happens, but it has to come to acceptance. And I have a simple rule to do things. That's unlearn to learn. Okay, it is very important to come out of that part that you were topper, you were this knowledgeable, that and all. Come out of everything, unlearn everything what you know, and start from scratch. And I think you will build up medicine very well. So that happened during my DM also. I was very good MD. That I used to solve most of the cases. But when I realized in DM that this is even a level up. Okay, so we have to be very careful at this point that whatever we carry as a clinician or as a smart student or intelligent guy, we have to forget it for one time. That we have to keep our slate very clean, where we can draw that medicine beautifully. Okay, that's a very important point. The acceptance that, okay, now we have to start from very basic. Prove your metal, that's a one mentality, and I always keep that we have to solve things. That's the only way. That if you got it in you that we can do a medicine properly, that's a one point. It's like I think it's a more of egoistic side of me which is telling. And I always tell all medicine resident, keep little ego with you. That's very much important. And no one can tell you that you cannot solve it or you cannot do it. Okay, it's very much important for everyone. This is a very important thing. Again, slow and steady. It will take time. Maybe after first year you will be feeling that you do not know anything. Maybe in final year you might be feeling you do not know anything. But if you always try to learn something every day, that's again a rule. See, one thing every day, the daily point part or whatever we do, it's just the result of that. That it is something that passively I want to put something every day for every student here. That no, you read that much, na? You learn something out of that over a coffee or wherever you are sitting. But just see those 3-4 pages, what helps you. So one thing every day is very important. Now see, daily point is okay for first year resident or final year resident who is on vacation. Okay, that kind of thing. But when you are in second year, the daily points are not enough. It should be one topic a day. One topic a day. That is very important strategy for everyone. Okay, and be disciplined. I'm not telling that you have to read 8 hours, 6 hours, and many will tell there is no time to read like that. But if you keep a simple strategy of one topic a day, that will help. I will come to that, how to select that one topic and all. And again, it comes into discussion. And I think this helped me most, the mentor. This is the most important point of your medicine journey. I can still proudly tell that Sudha ma'am is my mentor. Okay, she was not my mentor when I was resident. It is right, we know the gap. It is very difficult to have constant guidance from someone that senior, right? So you follow the footstep, you see that how disciplined they work. That is one way of having mentorship without telling them that, that okay, I admire you and I would like to be a physician like you. So you should have some ideal like that works one. And sometimes someone will be telling, no, in my hospital there is no one like that. And that's the truth even, right? So that point we have to be very careful that you interact with one of your senior who can honestly guide you how to go further. This is very important. See, all this platform include MedCAS or whatever platform. They are not enough. They are not enough to mentor you. Okay. It's a human interaction. Please don't lose it. That's a very important point. Okay. I can guide you, my faculties can guide you, we can talk to you on phone, but that thing what comes from seniors is entirely different. Okay. So try to find a good senior. Okay, you will find it for sure. And that guidance is very much important. For your subject and all, we can guide you for sure, but believe me that someone to interact, because it is not just like talking on a phone or WhatsApp interaction or something. It's sitting together over a coffee, and coffee is also part of mentorship, believe me. And I think that that's a part we keep missing, that these are the things which we have to maintain. So your learning process, whenever you plan, I will come to exit to the Harrison point also, but whenever you plan learning process, it's going to be a habit which is not going to stop at 3 years. Plan something like that, that every day you look forward to learn something new. I still do, and I think I'm able to maintain it well. One way for me to learn things is to teach things. Okay, but that's my personal hobby, I will say. I love teaching, and that's a one way I keep staying updated. Some people I've seen they're very good at creating the algorithms and the art, and also that is also one way that you keep sharing, and that has something different. That sharing makes it very easy. So this even looks little silly, but these are the most important point of learning, and you have done it before, so you can do it now also, right? So we'll go to this part, what is important and what is not important. Okay, now every day counts, including the bad one and especially the worst one. This is very important. Okay, right now sometimes the days go so bad in residency that some mistake has happened and we are blamed for that. Don't take that blame so personally, because you are in training. If you already know that part, you would not have done that part. Okay, so it's again the part thing, the honesty of intention. Okay, I am not a preacher, but these are few things which I think matters a lot. Okay, the honesty of intention to do that work, even if it went wrong because the knowledge was not there, that is fine, but the honesty should not be lost. If you're cheating, then there is no answer to that. Okay, focus on your weakness, not other strength. This is for residency, too much important. When I joined Manipal as MD, my co-resident was so good that he was very good intern at his point, and so he knew almost everything what is going on. And I still remember his word on day 3, that Sanket, I am now in charge of the male ward. And I had no idea. I had no idea what is in charge of the ward and what does it mean even, right? So sometimes you go to that level. Then I realize my weakness is I really don't know anything. And that guy knows so many things. So rather than envying him, I just started learning from him, that how do you handle these things. And it took me 3-4 months. Even he was not comfortable because I was so dumb compared to him. Okay, but that's okay. You take time, and then later on in final year, we were best friend and we were studying together. So that takes time, and it is going to happen to everyone. So we have to, because we come from all different background. Some colleges have very strict internship, and some colleges we just solve MCQ. I was just solving MCQ. Okay, so it took time. So it is very important that focus on your weakness, not on other strength. Okay, that is very much important. Focus on your strength, not on other weakness, vice versa. He was nice enough to do that for me. Okay, so that is also equal part, that when you feel someone is not doing that great, help them, and believe me, that will help you forever. Okay, because in 3 years you might feel a little competition. After that, no one gives a damn. Okay, no one gives a damn. Only thing which matters is how good relationship were. Okay, with almost my all postgraduate colleagues, we still interact and it feels so nice. But if I would have been in the rat race, then the relationship would have been spoiled. Okay, this is important. Be familiar and make it a home. Her hospital should feel like home. I felt Manipal completely like that, Jipmer completely like that. That whenever I am in hospital, there is no difference, because I'm there. Those 3 years are for learning. Whatever I'll be doing will be helping me that point and in future. And that's how I'll be working forever. So just try to do that. Don't get away from the hospital. There are many people that know hospital, leave and go to either outside or library and all. No, hospital is the place. Okay, try to make your reading room, or I think every hospital has that small reading room or the seminar room where you can read. Try to be in hospital as much as possible. If it's some other units emergency, also just go there and try to learn. Because see, what is given in Harrison or what we discussed today or on the online class, it is no way equal to what you deal that patient on that point. Okay, there is no match. These all things are to guide you, but every opportunity with a patient interaction is the highest form of learning. Do not forget that. Food, yeah, I'm good, so I will keep telling about that. And I have that part that if I'm hungry, I'm irritated. So I used to make sure that I have my enough food, whatever happens. Okay. Sometimes I may skip one patient and tell my senior that I've forgotten, but I will not skip food. Okay. I skipped initially 2, 3 months. Then I realized it's not worth even. Okay. So friends, ask help, and you are not there to get degree alone. This is something you have to be very careful about. Okay. And this is with the current trend of getting into DM, that okay, nahi yaar, we have to do MD because otherwise we will not get in super specialty. And I agree that it's a mandatory criteria. Okay. But do not ignore other subject while you're doing it, because sometimes the interest itself changes. I am very surprised that people are so focused now that while joining MD, they are sure they are going to be cardiologist. I was not aware only that what is happening. I was sure about one thing, that I am going to be a very good physician, and just stick to that. Try to learn everything. Then you do specialty. It's fine. It is, I will say, in a way necessary nowadays, mostly in metro cities. Do the specialties, but do not make your MD very weak. It has to be like in highest form, because when you will go to DM, again, for your first year, it's the same journey. Stronger the MD, better the DM residency. Weaker the MD, you will suffer like crazy, because your colleagues will be from institutes and they will be knowing better than you. And that point you feel guilty. You know, this should not have been done. In MBBS, it's fine. Like no one judges you. Okay. But in DM, they judge you if your MD is not good. Okay. So keep it very. Patients are best teacher. I keep telling you, no grudge to keep. These are small, small things, but please ensure this happens, because that's what makes the journey beautiful. Other department matters, and specifically, like we used to tell that have girlfriend in each department or have boyfriend in each department, because that's how the work gets smooth, right? You want a radio call, you want a patho call, you want the orthopedic call or anything, it has to be smooth enough that in you do not get irritated much. So have friends everywhere. Okay, that's a very important point again. And sometimes, see, when the journey will evolve, you will start learning from each other, that okay, this is how we do and this is how they do, and then you come to a common conclusion, okay, this is the ideal way to do things. Okay. And then the very important point, medals are not compulsory. Believe me, there are so many people who get in competition of the medal and they keep reading instead of keep treating. Okay, treat more rather than read more. Okay, that's a kind of most of the time which will help during training. That if you've seen more patient, if you've solved more patients rather than you have completed more chapters, it's more useful. It's completely fine to wait for 1 year, 2 year, 3 years after MD to go into super specialty. Okay, it's completely fine. I'm telling from my experience as well as the people who joined me in JIPMER, who were in JIPMER, I can say they were my 1 year, 2 year junior, but in MD they were even senior to me. Okay, no one was in hurry. It was JIPMER we all were aiming for. So that kind of goal should be clear, and we will come to that part. Fine. This is a very important question. Time to decide super specialty, and I keep telling it's $1 million question. But you have to answer a few things to you when you decide or when you talk about specialty. That why did you took medicine? As a bridge to super specialty, or you were really interested in medicine? Okay, if the real interest of medicine was there, while doing medicine you will explore the specialty. I explored that. I am good with neurology, I love neurology, and I took neurology DM. But after going into DM, I realized this is not my cup of tea. Okay, that can happen because medicine was more interesting for me. It was very difficult for me to accept that I'll be just looking at one system predominantly. I'm not telling that completely, but predominantly. It was difficult for me. Okay, so I switched back to again my senior residency, and then during senior residency, I explored that I was zero at rheumatology. Nothing. I was not knowing anything about rheumatology as a good MD. And I think it happens to majority of us. For rheumatology, hematology, and endocrinology, we are not that strong compared to cardiology, respiratory, and neuro because they are major cases. So we know it very easily, right? So this is very important point for everyone, that we have to decide it why and what super specialty. And this questions I discuss with everyone very pragmatically, because I think I have interacted over last 1 year 50 to 60 students who were going into that confusion of super specialty part. Okay, so why and what is more important? And believe me, you have to keep one part of finance. I'm not talking as a good Jew, I'm talking as a real friend to you, that finance do matter at that point. Okay, we have a question. Yeah, sir, this is the problem I'm facing. Yeah, we will come to that. We'll come to all the things, and we will come to this for sure. Okay. So this is very important, that finance part is important. It's not something that I love that subject, so I will do it. No, you have to see where you are tentatively planning to practice and what is the scenario of super specialty there. Okay. This comes later. Once you crack that NEET exam and you get a good rank, then it comes. But this comes into picture for sure. Okay. The financial scope of a given specialty. And we keep telling very bluntly that rheumatology has no scope involved in the specialty, so we do not have much scope of earning at very initial point. Okay, and that's the brutal truth what I am telling you. Okay, so it's very important that you have to keep that. The love of subject, yeah, I love rheumatology, but the curve is little longer when it comes to finance part. And if you want to use the bad means, which I do not prefer, but it's your choice, what I will say, there are so many ways that you have shortcuts. Okay, but I will say don't go for that. Wait for the right time. It comes for everyone. It comes. Okay, so that's a very important. The finance part. Second point is interest to the super specialty, and third very important point: do not consider your peer pressure. Not at all. Zero. Okay, that he got cardio, he got neuro, he got this. Don't consider it. Our journeys are completely different. Not at all. Okay. I'm not sure what my colleagues who got in endocrinology, cardiology, my majority colleagues studied from Jaydeva Nimhans and many institutes, including Sri Chitra, AIMS, GB Pant. I'm really not sure what they did today. I'm not sure about that. So our journeys are completely different. So do not go and that peer pressure. It's very important. You wait for your thing. It's very important for everyone. What after deciding that specialty has been chosen or what you have taken, that you have to now explore it. And again, for 1 month, it's fine. Give a time. If you don't like, leave it. There's nothing crime to leave a specialty. Okay. How tough is the competition? Actually very tough. Okay, if you want to go in institute, again I have some bias because I belong to an institute. It really matters. Okay, at is the training part matters. So your DM thing, you are not going to do too much in hurry, but you are going to do from one of the best college you want to. That's why keep a goal like that. You can't compromise on your goals. Okay. Like jo milega le lenge. No, don't do that, please. Okay. Because this is what you will do forever. The DM is like that. Fine. How does it differ from NEET PG? I will tell you a very important thing here. It completely differs from NEET PG at one point that you are already skilled with solving MCQ. What you are not skilled right now is reading the depth. Try to develop that. Second point, at NEET PG, where you are giving from MBBS to MD, it was accepted by society that you do not know anything. It's fine. But when you are MD, the doctor fraternity at least do not accept you that if you do not know anything, you are just preparing MCQ. So that's a very important point to remember. You have to be a good MD who can practice medicine, and are already skilled with MCQ. So focus on the subject. One point we commonly ignore, and I will keep telling, is a biostat. Be very good with biostat. Good in the sense, I won't say the best, but be good. Don't ignore it, because in when you will go for this MCQ exam, the competition is medicine plus biostat. Now see, medicine everyone reads. Okay, biostat only few reads. So that's a secret. If you are good with biostat, you will crack it. I realized that while giving my exams or attempts in the JIPMER, once I had ranked 14, then my rank went to 5, then it went to 3, and then it went first. Now in this 1 and 3, what I had advantage was biostat. My biostat questions were not getting wrong. So I had an edge over many who were in competition. Because rheumatology, everyone was good. Everyone knows from where to read. Biostat, people were not reading only, right? So when you are in the top, you want to crack the competition, you have to use something like this. This will really help you. So don't ignore it. Okay. Is there something else? If not DM, I will come to that part, as already the question was raised, and that's a very important point to go for. Okay. Now this is something, mental health is important. And I think in this scenario, I really do not want to ignore it completely. Okay. The first point is, do not achieve that by screwing others. That you are not comfortable does not mean that you will make others uncomfortable. Okay. Enjoy the workplace. I know it's a very difficult sentence to tell. I hated Manipal, the place, the beautiful place like that. First 2 months, I hated it because it was difficult. Language and people knowing so much, and we do not know them anything. I was told, even I still remember that incidents. One of my he told that you start insulin. I was clueless. What do you mean by start insulin? Okay, we know there is a long acting insulin, there is short acting insulin, but we have never practiced insulin. And he just took the case paper from my hand and wrote it himself, that this is how it is written. It was so insulting sometimes, but that's fine. You have to bear it because you never learned during your internship. Okay, so if you're not learned it, it's fine, but you have to start enjoying. And like later we started laughing on all this point. कि इस पे पड़ी मुझे, I was scolded on this point, but you laugh on that. You must learn that this does not get repeated. I can still tell that point, that after that I never got screwed up for screwing insulin part. I was good with insulin. Okay. So to start learning, you got your weak point. Someone showed you weakness, you solve it. Have a company, and I had lot of company. My co-resident from medicine and other departments, and keep discussing it. Okay, this is what happened, and this is what I am trying to solve it. This again, a small thing. I know the social media is different when I talk 10 years back and now, but still talk to family and friends. Okay, that things makes very easy. Have antidotes for the toxic people. I won't go in much detail of that. Everyone knows how to deal with antidotes. So go with that. And award should not motivate you too much. This is very important. Okay, that consultant told you that you are doing good, your colleagues feel that you are really good, you are intelligent, you got your senior to achieve that gold medal, and he becomes your idol. No, 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 don't do that, man. Come on. Okay. So the award should not motivate you much. For me, motivation was something. I had few seniors who were so good during emergency and during rounds that they will solve cases very fast. But same time, when it comes that when they were presenting cases and the questions were asked to them, they were not that fluent in answering. And it was always for me contrasting part, that yes, you are so good during the round and everything, but when it comes to that case presentation, why you fumble and all. They are very clear. We are not shorted about that part, how to answer very correctly and all, but we are very shorted about how to deal with our patients very correctly. It's fine. It's some people have both. Okay. And some people have just one part. They are very good case presenter, but when a patient is given to you, they do shit. Okay. Don't do the last part. Okay. So don't go into the last part. The priority is solve the case and then solve the exam, and try to do both. Both are important according to me, because you are giving sincere attempt to answer the things, means you are learning more and more. It's not, there is no excuse that no, I know how to treat my patient, exam I will deal it. Don't do that. Be sincere about exam. It will actually enhance your practice. Okay, that's very important point which comes. Okay, now this is important to all of us. Goals of each year of residency, and these are the 3 slides I thought if someone would have told me, it would have been easier. Okay, and I discussed with ma'am also that okay, this the total class, what the discussion, what we are doing. I discussed most of the things with ma'am a few months back. Okay, so the first year residency goal is very simple: know your hospital and co-worker, and it is like our training: know anatomy and physiology, that how the hospital is and how does it function. If that is clear, you will start enjoying. Know the language. This is not for everyone, but for many of us. For me, Kannada was a new language, and for many like me who traveled from somewhere to settle in Karnataka, it was a new language. And without language, there is no way that we do medicine. So I took around, I think, 3 to 4 months just to learn basic language. Then my medicine started. So if you think in first 4 months you did not do anything, it's fine. We were together. Okay, so it's completely fine. Know the language. It's very important. It is okay if life is not good. We all felt at some point, right? That this is terrible decision what I have taken. Like, because I know there are many people who join medicine like having that we crack cases, house MD and all shit, right? And the reality is that we are collecting blood and collecting reports and writing the start summary, and it felt so bad that what I'm doing even, man, right? But it's fine. It will improve. And believe me, again, the discharge summary is a skill. I will judge you by your discharge summary. I will judge you by your notes. And everyone judges everyone by notes. Okay, it's very important. How precise you write, how good you write. So this all small things, I so-called small things are not small. They are the real things. While you type discharge summary, you are actually knowing that patient was admitted with this, and this. These things were done, and patient improved, did not improve, patient is going discharge against medical advice. See the process that we took all the right steps till patient did not improve, what we missed. These are small things but very important. Survive, this is very important. Eat and work, but I think now things are not that hostile, but if it's still there, but go do these 2 things. What to learn: approach to patient and emergency. This is very important. At end of 1 year, you should be able to know many of the emergencies, at least for first 2 3 hours what should be done. Okay, and this is for me ever. Nothing is as impressive as the punctuality. Nothing. Okay, knowledge, nothing matters. If the round is 8:30 and you are there at 8:15 or 8:20, that no one has to wait for you, that's the most impressive skill you can have, the punctuality. Okay, still for everything, even I am little punctual about parties also, that I do not miss. I am there on time. Okay, so try to do that. It's difficult, but that's a one point which will impress. Okay, anyone joining new, anything happens, a unit change or anything, the time will be respected first. Okay, he comes on time. When you're in second year, know the place, you know the hospital now, know the place, because it's time to enjoy and make it good. And it is compulsion, according to me, that you really have to enjoy in second year. Explore the places beyond your hospital, including library. Okay, include that's one as a part. And we always had that thing that first year is all about your hospital, second year is all about outing, and like we had a beautiful beach there, so you should be there. And final year was all about library. Okay, so but second year is the point you will actually develop more relations during your residency, which will last, I think, forever. Okay, and that's the beauty of medicine residency. Find a mentor and study partner. This is equally important. Right, my most of the studies have gone with discussion. Still, it goes like that. If I want to learn something, I will include people or involve people, that this is one complex area I am not good at. Let's do in part, and we actually solve most of the things. Okay, so this is again important. And I told from starting, one topic a day. There is no excuse. If you're in second year and you are not doing one topic a day, we are not doing great here. Okay, because you have 365 days, right? A year. If you just maintain it by 80%, your 300 or 250 topics are done till you reach the final year. And this is again very important. Okay, we have a message. What are the names of app that sir told at the beginning? We'll come here. Okay, we'll come to that. Every question will come back. Yeah, fine. And this is very important. Express yourself in second year. Okay, have your opinion when the cases are being discussed, when decisions are being taken. You ask the doubt decently, politely, but ask the doubt and express yourself that I think this is correct. I think this is not correct. I think this is new. What I read recently, it should be done like that, or why we are doing like that, right? So it's something like we keep following protocols. Now, if you do not doubt protocols during your residency, you are not going to be a great doctor then. Okay, I'm not telling you to break protocols, but start doubting protocols. Okay, why they are there. And sometimes you feel that no, this senior person has established that just because of that egoistic point. And later on you realize, oh, it was not egoistic point, it was more of a checkpoints. Okay, or the checklist. This much is compulsory because they all have regret that we did not do basic for this patient, so we missed this patient, we lost this patient. So many of the time the compulsory protocol is a product of all this part. So be logical about protocol, try to understand even emotion of that protocol, and mostly do not break it, but do not accept it very hard. That during my MD residency, I used to do this, so my total practice of medicine will be like that. No, do not go into that trap. Protocols have a location specific meaning. It cannot be generalized. It cannot be generalized. So be very, see, these are the things I actually started learning only when few mentors started asking that, Sanket, do you really think we should do this, or are we doing as a part of rule of our unit? Okay, so you should have those kind of seniors who actually keeps asking you this kind of question, which are very important. That's ICU. I had few units that ICU every alternate day X-ray, and I was surprised that why it should be done like that. It does not make any sense. No guideline says that. I never wanted to break that protocol, because the emotion behind that was that few patients were lost, and then someone will tell, no, yeah, you should examine. It's a clinical medicine. I completely agree. Okay, but it was made by someone which was he felt very bad, right, or she felt very bad. So it's fine to follow protocols. But when I started going to other unit or started doing my senior residency, I was not very strict that every alternate day you have to do the X-ray. Still, it does not make sense for me. Okay, it just makes sense that I have to examine my patient every day and have to see it thoroughly. But when time is not there, this kind of protocol comes that you do not miss things, right? Again, this is important for third year residency, that what we are doing. Thesis before you jump into something, complete your thesis, whatever. And the best thing is to complete thesis in second year, at least writing part. Okay, your introduction, methodology, result table, structure of discussion can be written during second year. Okay, it does not take. And I think I got a very good advice from my senior to do this. So in second year, almost my thesis was written. It was done. So I was just waiting for the result analysis. And the moment result analysis came, I had to adapt to the result tables and I had to start discussion. So it took me 3 to 4 days only to complete in final year. But yeah, in second year, I spent much more time doing all this part. Okay. The part like referencing, how to use Zotero to do referencing, right? This all things are very important. I think I may be old enough because I am not much aware now what AI is for referencing. Okay, I still use Zotero. So Zotero is there. I think then there is something called EndNote, which I used during MD to make this referencing in order, right? Because you write review of literature, and when your guide says no, Sanket, this paragraph, I think should be up. Now, if you put the manual reference, your life is screwed for sure. Don't do that. Use Zotero, use EndNote, or do something. How to learn all this thing? YouTube is there. Okay, it's very easy. And try to publish one paper in second year. So when you publish a paper, including a case report, what happens is in case report, whatever we mention, we write references. In case report, there might be just 5 references. But for those 5 references, use Zotero. Okay, so that makes life very easy, that you have experienced a miniature part of thesis by a publication, and you are doing great if you are having publication in second year, right? So be motivated to do all these things. There is no escape. I still have many people telling me that Sanket, you did so many publications, you did so many things. Does it help you in practice? My answer is yes, it definitely helps me. When I read anything for practice, because I try to stay updated during for my practice, I have enough thing that what to read, what not to read, because it's something we know now, it's an infodemic. Like there is so much information that you should know what to clearly ignore, or the quality of paper. Sometimes I will say, no, this is not worth my attention. Okay, so that's very important. When you have done things, it will be very easy. Or sometimes everyone says, yeah, chalta hai, nothing matters, you can still treat patient, it's fine. Okay, it's my personal endeavor to perform better, so I will keep doing that. Okay, so this is very important. Now the again part, teach if you like to teach or discuss. This is very important. Okay, for me it was teaching. So I started teaching many undergraduates, and I think MedCAS is a product of that. Okay, so I started teaching, discussing, started to taking clinical classes for undergrads. There is a class of parallel for undergrads, right? You take it completely and you read from everywhere. You read Alagappan, you read whatever books you're reading, Harrison and everything. Then you take class for those undergraduates. One point, they will be impressed with your teaching. It matters sometime, fine. And second important point, your parallel topic is done, right? And see, the undergrads are best learners. They will ask you crazy questions. Okay. And those crazy questions are sometimes asked by your examiners also. So that will solve things very easily. So teach. If you're not like more in teaching, then just discuss with your colleagues that I've read one topic. Can we discuss it off? Don't keep everything inside you. Okay, that's terrible idea. Okay, medicine is so vast. More you discuss, more you get input, and more you become interactive, and it becomes easy. Even discussing with your colleague is giving you some confidence in answering in Viva. So do that. Team makes it easy in general clinics, like we say GC or the case presentation, right? So whatever, I think we have few classes with Sudha ma'am. The There the things were really difficult, the general clinics, because the question will be asked by, I think, around 10 professors and associates, everyone will be there. So to answer them, it is not enough that if I take my case alone, if I prepare my Viva, what probable Viva alone, and then I go for the case presentation. I always used to have 3-4 residents with me, that I am taking case, you confirm my examination finding, and one will be just preparing Viva that, okay, this is your case, that what are the possible Vivas. So I had one confidence that 70% answers I was able to give it from starting. Okay, so that you have to start making it. That comes because I had a team. So when they have case, I'll be helping them. So this is again a very important point. So in final exam, they only helped. Okay, we have this 4-5 cases, and it was very easy. These are the probable Viva, and we are done. Okay, so there was no fear of failing, and that is very important for everyone. Take a lead and start collaborations. Okay, this is very important. Do something new in final year residency. Okay, that you want clinical pathology meet, you want clinical radiology meet, you want to go to respiratory department, ask them to discuss few last PFT done. Start doing all this thing, because in practice, this is the only way we keep going further. And even though not a fan, I will come to this, the MCQ matters. Okay, I am not denying it completely. The preparation of NEET assess matters. Earlier the done, better it is. Okay, so I won't deny it completely, but this should not be your focus complete. Okay, if other parts are good, and if you're doing this simultaneously, it's completely fine. Okay, now the main point, how to Harrison. Okay, that was the title. But if I do not give the proper context and just start Harrison part, I was not happy with that, because many of the students already asked me that when we join residency, we have no idea. And I am sure this is helping. I'm speaking so much, but I'm sure it's helping. Fine. So this is a very important point. Okay. And the steps are, have the book, start reading, start discussing. Okay. It's not that easy. Be honest, right? It's not that easy. But first step is to buy a book. Okay. Please do that. Okay. It took me second year to buy Harrison. Okay. But buy the book. When it is there, sometimes you will feel guilty, you are not reading, and you will start reading it. So first step is buy the book. That is very important. And I will say, see, there is no alternative, no MedCAS, nothing else. Okay. I won't name any other platform. Let me be honest. Okay. There is no alternative. Have your book. Soft copy, hard copy is your choice, because the way you read is fine, but have your book. That is very important. Okay. Now preparing for exam, then I'll come to Harrison more. Okay. The first is be pragmatic. that you are not going to complete total subject. It is impossible. Okay, there are 480 chapters or 488 chapters in Harrison. You are not going to complete it because it's not only about Harrison. It's about Harrison. It's about clinic with the Indian adaptation of setting. It's about biostat, and then it's about the overall recent update. Okay, this is not the only part of your preparation. It is this. So if your this part is very, very, very good, and if these parts are not done, you are not doing great. Okay, so be balanced. That what are the things which will come and what are the things which will not come. And this is sometime the region specific, the questions and the university exam pattern and all. So it's a second year you start knowing all this point that what is going. Just explore last 10 years question paper. We still do that. Okay, the 10 years paper gives us idea that how my university is doing it, because my MBBS was from Gujarat, then I went to Karnataka. So there is definitely a pattern change that we have to start realizing. This is my always the point, read to practice. You have read COPD today. Tomorrow your patient comes with COPD. What better you can do for that patient? If your reading is answering that, you are in right track. Okay. You are not new to MCQ. So do not waste too much time solving the MCQ banks. Okay. Try to read as much as possible because that will help you specifically if you are aiming forward to INI. Okay. It's not the MCQ as a secret. It's a completion of reading, which is a secret that have a format. This is very important for everyone. I will come to this part, or let me discuss it before going further. So whenever you read any topic, the first thing is why you are reading, right? It is for your ward case, then be very quick and solve that part. If it's your for exam, have a format. What kind of format? If the topic is 10 page, when you complete topic, you should have 1 page summary. 1 page summary. If you read instead of 10 pages in future, it should be enough. So for first time when you are reading it, invest the time. Let me give you one example, and I recently did with one UG class and I loved it. I took class on major histocompatibility complex. Okay. So we spent, I think, around 10 minutes on the first slide, which was just named MHC, the major histocompatibility complex. Because this is to ignite the idea. When the word comes to your mind, MHC, what you go for that. Okay, so let's go for the word histocompatibility. It tells the two tissues should match. It's a histocompatibility. So it's a two kidneys matching in the transplant, right? That's the one idea you keep getting. It's a major, means it's not about everything, but the majority part comes through that region. It's a complex somewhere. Now it can be gene, it can be protein, it can be anything. But having an original idea, which may be wrong, completely wrong. Okay, but it's fine. But if your starting of reading has zero idea, that you are not aware of anything like that, and you start watching a video, you are not doing good. You start reading Harrison, you are not doing good. What you have to have is, when you read a title, make an assumption or perception that what it is, right? And once you do that, it becomes quite easy that, okay, you might be, while reading, you might be completely wrong, or you might be supporting your logics. Okay, still have some thought process left in me. There is a great gray matter left in my brain. Okay, so you start enjoying that. But if you just start watching video with a zero mind, your imagination skills are gone. Don't lose it. Okay. See, the worst thing which can happen with video, even though I run MedCAS, I'm being honest here, video kills your imaginations. Okay. Video kills your imaginations. If you do not put a thought process to the topic of your own and you rely on your video, it kills your imaginations. Okay. And killing imagination is a crime because you have a lot of things to extrapolate when you imagine things. Okay. If I read the kidney transplant, my mind should be active enough to read liver transplant, heart transplant. And if I read kidney transplant and the question comes as a heart transplant, I'll write it off. Okay. That what are the donor criteria, recipient criteria, pre-transplant requisition, during transplant care, post-transplant care. Even though it's completely kidney, I'll just change it with heart. Okay, not in practice. In exam, I will do that because that's what the imaginations comes with. Okay, so when your topics are not covered, you have to read like that. I'll give you one more example before we go that. Okay, I had a question in MD. It was ruxolitinib. I think I've told this story many times. It was ruxolitinib. Okay, it was somewhere in 2014, and the drug was approved for lymphoma, and then it was coming for polycythemia or somewhere. Okay, so I had only idea was tinib, imatinib, ruxolitinib, right? So it's a intracellular inhibitor of tyrosine kinase or something. Just I made stories almost similar to that, used in hematological malignancy, used in this new approaches are being developed. I might have got 5 or 6 marks out of 10. Okay, at least 5. Okay, because writing is important. And this only comes when you start doing this imagination part, that you extrapolate things very well. Okay, so it was completely on that, the extrapolation, because the paper 4 has this surprises that suddenly new things comes and it becomes so difficult if you have not heard any time of that. Okay, so try to keep doing that. Write at least 1 or 2 page, it helps for sure. Now this is more towards Harrison. First is, why don't we talk? Okay, most of the time when we get Harrison, we go into that corner of our room and we start reading it. Before doing that, talk to someone who has read half or more than half of the Harrison. He will tell you better things, or she will tell you better things. Ki, aise start karo, start like this, do not start like this. These chapters are not first thing to read, that you do not go to directly something called genetics when you start Harrison, right? You go to dyspnea, you go to chest pain, you go to headache. You start loving that book like that, okay, we are in sync, fine. You are not starting from zero. And this is very, very common mistake I think we all do. There, mujhe kuch nahi aata hai. It's like, I don't know anything. I have forgotten everything. So I have to start from zero. Okay, no, you're done MBBS. Come on. Okay, so at least 30% of the Harrison, even if you're not read, you know it. Fine. So you do not start from zero. You have seen patients. Come on. For 1 year, you have seen patients. In second year, you are touching this book. You have done a lot. So you're not starting from zero. And you were actually pro at medicine MCQ when you did MBBS to MD. So why you are actually forgetting all the skills? Do not do that. When you start reading Harrison, carry everything with you. And for final years, I think this is a very important tip or a realization. In final year, when you read Harrison, try to correlate your patients, what you have seen. You will be sometimes laughing, no, I did mistake, it's fine. But try to correct it as much as possible. I did not read Harrison in my first year, not at all. Okay, but when I was reading in final year, it was so much fun that, okay, I have seen this patient, but I did this, Harrison says, do this. And sometimes both were right. Okay, because I was following my mentors who are also good physicians. Okay, but in MCQ or exam, I will follow Harrison. It's fine because that's a common belief, right? So we have to be very careful, or we have to be very sure that, okay, we are not starting from zero. And final year, remember from your patients. When you ask me about a patient treatment guidance, mostly I recall my patients. I do not recall books. That in that patient, I have done that. And so the number should be enough. You must have seen enough patients. And again, someone will tell, no, sir, in my hospital, there is no load only. The patients are not coming. The numbers are very few. Our setup is different. I completely agree with that part. Okay. But whatever has been seen, try to be sincere about that and then later on explore. Okay. Still, books are your friends. Okay. Understand the book. I would say love it. Okay. So it's something when someone tells me that, okay, again, the same drug, if I tell ruxolitinib, if someone tells you have to relate in Harrison, I know how to go there. Okay. That there is a first section, which is profession of medicine. Second is cardinal. Then there's a pharmacology. Then there's a hemato-oncology. In hemato-oncology, initially they have given oncology, then they have given hematology. In hematology, in oncology, there is initially the principle of chemotherapeutics and the newer drugs. There somewhere it will be coming, right? So those small things try to explore. It is again equally important for each of us that how better you know your book. Okay, that if this topic is given, and it only comes when you keep reading it, there is no other way. For me it came so smoothly because I have taught Harrison third time. This is the third time I'm going to start from tomorrow day after. Okay, so just be more and more aware of the book, and then it will become easy. So I will say it's a love, right? That's a perfect word for Harrison. Love the book. Okay, schedule, total plan, that how you are going to do it, and be successful at 80% rate. No one is 100%, no one. Okay, 80% is the ideal goal, that in 1 month there are 30 days. In 30 days I have started to plan 30 topics a day. In that I have completed around 25. I'm doing great. Okay, that is something we all have to do, that when month starts, at least itne topic likh do. And the commonest question is, how do you get this topic, man? That how do I decide it's a 30 topic? For me, it was very simple thing. The last 10 years paper. Okay, that's a common tip. And it is a pseudo confidence that I have done my last 10 years university paper. So I'm sure. So there is no topic problem, right? Because each year is 40 questions and you get 10. So you have 400 questions. Your year formula ready for you, man. Right? So write those topics and try to solve it. I still remember I printed those topics, and then we'll put, okay, this is August, this is September, this is this. And many of the time I'll be completing 70 to 80%. Okay. Some months were so better that I used to advance it, and some months were terrible that it will be just 50%. But that keeps happening. But if you do not have a written thing, how we are going to solve it? Okay. Now many of the YouTube motivator do that, right? Have plan, 5 a.m. club and all. Nothing works for resident. Okay. Nothing works. If your duty comes, what 5 a.m. club, right? It does not come there. So be realistic, be very much realistic, but be disciplined at the same time. That okay, 5 a.m. new hua to evening kar lo, finish it off, right? And after doing that, the next step is very important. Why don't we discuss? I read cystic fibrosis today. I read asthma pathogenesis today. I read asthma new guidelines today. But have you told someone that you read? Okay, please tell, please discuss. Your topic is done. And then if you find a sync, tell them, can you read one more topic and tell me also? Okay, this is how we do it. And this is, I think, at least for myself, we did it like that completely. So I never had to read total Harrison. I had to read, I think, maybe 30% of that part, because remaining 30 were being done by my friends who were reading it, telling it, and I had complete faith in them because they were very good clinicians as resident. So that's a part that you will keep finding those people and you will keep doing that. Choose topics very wisely. Okay, this is again very important. For first year resident, the choosing topic, it's only one way. Which patients are admitted in your ward? Read about that. Okay. For second year, in what specialty you are posted? Read that. Third year, university exam paper. That's simple. Keep doing that. Third year has no excuse that he can ignore the pathogenesis of multiple sclerosis. If this was asked, you have to read it. It's a boring question, pathogenesis. I still love it. I love pathogenesis part. But many of the people find it very uncomfortable to read pathogenesis and all. But in exam, there is no excuse. It's not our comfort. We have to give it, right? So choose it very properly. Again, I will keep telling, love the book, but keep looking around. Okay, that's a part comes that sometime, like let me give example of OP poison. If you read from Harrison, you will cry. Kuch fayda nahi hua, nothing it helped. It does not help to even treat a patient. Okay, so that's not sufficient. So you see, what are the national guidelines for that, and you go for that. See, running a platform, MedCAS, everything is fine. But right now, what I'm doing is I'm just guiding you to the right thing. That still we do like that. Patient-based thing, book-based thing, searching literature, reading journals. This is doing medicine, not using app. Okay. Even my team says, they will say, what Sanket, what you were doing yesterday night. Okay. I have to tell you truth. Okay. And that's very important. Truth is the important point of what we are doing. There is no point if no summaries. This is the highest important point for any reading in residency. Do not waste your time reading if you are not making summary. Instead, go out and enjoy your life. Okay, if you enjoy reading, that's a different thing. Okay, but if you are not making summary, do not read that topic, man. Come on. Okay, instead of reading asthma A to Z, just read asthma clinical part, epidemiology, and pathogenesis, and make a summary of that, because that 10 pages from the next point becomes 1 page. Okay, so I had very simple, even I did that during my DM preparation, that I had Harrison to prepare, I had Kelly's textbook to prepare, because Zipmar was asking that you prepare total rheumatology and you come, right? I cannot read two books because exams were simultaneous. One side there is NEET, one side there is Zipmar, one side there is PGI. So for every chapter, I had almost 1 page to 2 page summary. So if I want to revise in last 20 days, I just read those parts. I do not touch my books. It was not worth, and it is not time. Because I have seen many times that when a final year is giving exam, the day before the exam, he is opening Harrison and reading a lot of things. No, it does not make sense. And we get tensed that we are not able to complete it. Come on, man, how can we complete it? Right? It is impossible. We cannot complete Harrison day before exam. Right? So important. See, I will never ever read COPD before my exam. It's impossible. I know COPD. Right? So start developing that confidence that you know this, you know COPD, you know heart failure, you know malaria, you know typhoid. Why you are reading before exam? So this is the important point, to choose your topic very wisely, that exam day, these are the revision points, these are the revision notes, nothing else. Because say, again, I told you, it's an infodemic. Someone will tell you, this topic is better in Davidson, this is better in Harrison, this is better in Kundu, this is better in Alagappan. This all are going to happen. This is still happening to you, all of you, right? So what you have to do is, what I think I had one senior, he was not my senior, but I learned from him, Dr. Arvind, that he used to make, oh, where it went. Yeah, fine. So he used to make very beautiful summary. Oh, it does not work. Yeah. With the base. Now the base is very important. His base was Harrison, and his base was, there was a book we used to read in Manipal, the Sastri. Okay, so on that base, whatever is coming, like if I'm reading something new in cystic fibrosis, then sticky note goes to Harrison. Okay, it can happen in your iPad now, right? So what if you're reading something new, everything goes to Harrison at the end. Okay, and everything goes to this clinical book. Whatever new comes, only two books which keeps modifying. Okay, and that's one way to generate your material. Okay, so this is very important, that we have to be careful about generating material like that one base book on that. Okay, you read an EJM article today about hyponatremia, your note goes to Harrison hyponatremia chapter, that this is the points from NEGM 1, 2, 3. It's not like now you add hyponatremia new and then you bring things from there. Okay, decide something, one base, and you build up on that. Okay, if you are very comfortable, no, NEGM hyponatremia is best and I still believe it is best. Okay, so print those notes, and what comes from Harrison, put it there, and in your Harrison write that it should be read from NEGM review article, printed and kept here. Okay, or in your iPad, if you're doing, now I'm doing many things in my iPad that I keep building up on my book. Okay, but have that basis. For me, rheumatology basis still carries textbook. We have some 6 books we follow, but everything I read about any topic goes to this. If I read a new trial of systemic sclerosis today, it goes to my Kelly's, because at the end of the day, I keep revising that when I practice, or keep saying that I know this is one source to see. So if you read something and you're not make a summary of that, and you're not make that where it is not reading. Okay, so these are simple tips. Again, do not waste your time if you're not making summary, right? I'll come to all the comments which are coming to this. Okay, now I won't spend much time here because you're very clear. You learn something every day, and we try to ensure that by daily points for group. I think group is doing very well, specifically Sudham's comment. Please note down those comments and even try to make a PDF of that. We are trying to, I think we will make it from our side also. So these are the best knowledge pearls you ever have. Okay. The Harrison is there on your fingertips. It's there with everyone. We discuss clinics too. And I think if you volunteer more for clinical presentation, I can have more and more classes with you. Biostatic, biostat and you know why biostat is important, specifically you are NEET SS aspirant, and there are mentors to guide you. And this is very clear message I have given throughout. Our spirit is very simple. We are not replacing, we are supplementing your medicine. Okay. I have no intention to replace Harrison or any other damn book. Just read those books. Those are the beautiful things you have. Okay. So I think with this, yeah, this we will not go much and learning will never end. You took medicine to treat patient, not just to solve MCQ. And this is very important. In medicine, you have to be a right guy at right time, at right place. And this is very dynamic. Okay, it keeps changing, but try to be that, and you will start or you start will enjoy the subject. Now I think you are free to ask question. I spoke so much today, I think. Fine. So I'll start with the comments and you keep adding question in comments. If anything is there, we'll go to that. Okay. So first is medicine. I loved always, but senior saying now DM, you can elaborate that part, pros and cons. See, I will say again, same thing. Let me be very realistic, which I should not be at this point when I'm discussing with resident. The private practice is a humbler and it is a terrible thing. Okay, because it's not about your degree and knowledge, it's about how good you are at your business sometime. But this is only for starting 1 or 2 year. After that, everything is about your knowledge. Okay, but in starting, this plus minus can come. Second, competition is really very stiff because we do not have any regulation, right? That only MD can do this or only this person can do. Anyone can do anything in India. Okay, so that way competition is a little more. The specialty gives you one edge, that competition becomes little less. That's all. In specialty also, there is a lot of competition when it comes to real private practice earning. Okay, because the real estate, the other parts do not respect your knowledge. This is the market rate you have to buy your clinic. Okay, that's how the things work. So if you have some business mind, really great. Otherwise, take help from your senior that how to do that. Okay. I will never say it is compulsory to do DM, but by doing DM, you become sure about few diseases as per your colleagues. Okay. In medicine, sometimes that feeling comes out to refer. I'm talking about our generation physicians. Okay. The seniors are really great. Like maybe 20 years back, they were really good with almost everything. But the way we are trained and the way the trend is going on of referral also and the patient preference also, if they have joint pain, they go to either orthopedic or rheumatologist. And now they are realizing that there is an entity called rheumatologist, right? For headache, they directly go to neurologist. So these things are happening. I am pretty sure that you'll be able to manage migraine as good as neurologist. But sometimes we only feel inferior, right? So that happens. So that's one part. Try to go into that. Okay, again, it depends on where you are going to practice. Metro, second tier city, third tier city, this all decides a lot of things. Sometimes MD medicine is more than enough if your preference is second or third tier. Okay, what are the name of the app? Okay, it is Medscape Up to Date and QX MD Read. Okay, and let me tell MedCAS. Okay, fine. So these are the app you should have. Okay, our medicine course just about to finish in August. Please tell what should be the strategy from onwards now. Okay, first, if it's going to finish in August, you are going for exam mostly, right? So if that is the part, you have to be very careful about one thing. Your university papers, you are good because it gives confidence and pseudo confidence, one part. And second point, common topics you know. Okay. Third point, very important. If something new comes as a material, don't touch it. Don't do that. Okay. It's not required now. You cannot explore something new. And very important last point, Epicon happened, right? So the updates in medicine, that book you should be knowing. It is helpful, even though it's a new thing. I think more majority of you have it in a Xerox copy and all, right? But that is something I always recommend all the students, because our paper 4 majority questions are set by that. Okay, waiting for practicals, theory done, great, that's fine, just relax. Okay, after that, once practicals are done, the journey starts towards more for your MCQ solving. Okay, and again, there it is your preference. You want to take a break and you want to prepare, or you want to join SRC or something what is being offered. My part was always to practice, so I kept in that, but it is a preference. I had few friends who took a break after MD for 1 year and they went to the best institute of India. I did not take breaks till I went to the best institute of India. So it's fine. It's a personal preference. Any specific things for DNB student as academic is not good in our institute. I completely agree with that part. And that is almost, it's not being DNB. Many of the MD institutes do not have good academics. Okay, I will say blessed or fortunate enough to be in an institute where academics were amazing. Okay. So when academics are not good, you have to plan. And planning is always who are your colleagues, who is one of your good mentor, who is your faculty, who can guide you more. And then planning around your Harrison. See, the topics are same, right, for everyone. And there is one advantage of this infodemic, that you can read from multiple sources which are correct. Now, whenever you read Harrison or something, or if it's through the app or not through the app, the first part is very clear. The first impression is yours. Cystic fibrosis, what you can imagine right now, right? And then you read the topic, and then again come back how good you were with the imaginations, and make a summary of that. So that one topic a day should work for you. Okay. Okay, you need your views after practical. Okay. Yeah, fine, sure. We start reading for SS isolation or doing SS. This is, I will say, it's a completely individual choice that how it works. For me, it never worked. I decided to read just for MCQ after my MD, but in 5 days I got withdrawal that if I do not go to hospital, I am not comfortable. Okay, but there are many hospitals now that where the SRC pressure is not much. You have to visit, I think, 3-4 hours a day. This is India, man. Come on, right? So this is how the things work. So you can choose either the lighter workload and then you be in that, or sometimes you can just, if it's 1 or 2 months, I still prefer it's fine. You keep reading. Okay, if you are not that much in other pressures, because see, every student has a different kind of pressure. I had few colleagues who told me that no, I have to earn, man, I have to earn for my family. So they were right. So they took 1 year just to have that part. There are a few loans going on. So it is very individual choice we have to make here. Fine. Okay. I hope it was useful. Any more questions? I'm available. And from tomorrow, we will not be doing this motivation part. We'll be doing more of a medicine part. Okay. So we'll start lectures from tomorrow. I will take 40 minutes to 1 hour lecture. Try to do it every day, but let's see how it works because I have a family to live with. Fine. Okay. Chalo, good night. And we'll end here.